want you to remember a few things. The lens from which you are coming is very important, meaning what is the perspective with which you are trying to assess a certain population. That will help you to know how to define that population and what data sources you need to use. So if I'm the medical director of a large insurance company, my population is the number of insureds in my plan. However, if I'm the health commissioner for a certain county, the population that I'm looking for, or the denominator that I'm looking for, is the U.S. Census Bureau data about the number of individuals in my particular county. Then when I'm looking at what population health outcomes matter, it's also important to understand my lens, right? If I'm a health commissioner, I might be really interested in rates of smoking or in some other health-related behaviors. If I'm an insurance company medical director, I might be really interested in rates of leg amputations or hospital readmissions or COPD exacerbations, because I might be more interested in looking at cost from my population health data, whereas the health commissioner might be more interested in looking at specific rates of correctable health behaviors in a particular community. So you can see that lens is very, very important. The other thing that I want you to always remember is that your data sources are also very important. And as you'll recall in class, we went over numerous data sources that feed your understanding of population health. So the denominator might be U.S. Census Bureau data, but it might be the totality of patients in your EMR universe, right? It might be all the patients in your EMR system. For me as a primary care physician, it might be all the patients who have me attributed as their primary care physician. I'm now responsible for that population. So there are multiple sources of data for the denominator, but there are also multiple sources of data for the numerator. For example, I might be most interested in a population health outcome around an infectious disease, or a chronic illness, or a particular health behavior. So you'll see that the data sources vary depending on what reason I need to understand a certain population health outcome, and for what use the ultimate understanding of this data is. You came to medical school to learn about individuals. Well, the reason is that medicine has changed so dramatically in the last 10 to 20 years, and physicians no longer can only learn how to treat an individual. They need to also understand how to treat the individual in the context of his or her family unit and the community and or populations in which they are living. So it's important that you understand population health principles for that reason. So in medicine, different ways that population health principles are being used are in health systems. Different systems are doing population health management to help their finances. So for example, in Cleveland, there are multiple health systems doing accountable care organizations, meaning that they are managing the population that they insure or that they are responsible for. It could be Medicare, it could be a group of employees, it could be a group of children on Medicaid. There are a lot of different ways. But those are doctors running health systems and administrators running health systems that are keeping track of a particular population. So it's very important in medicine to understand population health. The same is true in public health. So public health has always traditionally known population health and done population health because public health systems tend to work in larger communities and larger populations. So now population health is really a language, a vocabulary, a way of talking to one another, utilizing the basic science tools of epidemiology and biostatistics to achieve a common outcome. And that common outcome is health for communities. So the individuals that live in those communities and the population living in those communities.